Welcome to a pastoral care response to the COVID-19 pandemic. This training is to help equip you as you guide others through risk decisions. My name is Stacy, and I'm a chaplain specializing in global crisis response. First, it's really important for us to understand the unusual types of decisions that people are having to make, are forced to make these days. They aren't decisions that we were making a few weeks ago. Now, these are not all risk decisions. Some are moral or ethical in nature, some are both. And one of those would be, should I relocate or not? Should I take my family, move to another city, or out of the country? And this is really particularly for those people who are working overseas. And that's a population that I work with a lot, and maybe some of you are working with. And they're thinking through this kind of thing right now. Is there medical care that's adequate where they are? Do they travel a lot for work? Should they travel? Is it essential travel or not? How to determine that? To quarantine or not? And we'll talk more later about quarantine and shelter in place and what those terms mean exactly. Should I seek medical help, or should I stay at home and take care of myself or my family at home? Should I go to church or not for those places where churches are still allowed to congregate? Should I help my neighbors or others, or limit my exposure and the exposure of my family? If you are a health professional, who to treat, who to help in a medical setting, especially when medicines and equipment, beds are limited. And then there are the daily distancing decisions. Who do I distance from? How do I do it? When? And how much distance is enough? Do I go into the office, or do I stay home? Are you able to make that decision for yourself? Maybe you're not. And if you aren't, how do I keep myself safe if I go in to work? Now, you can probably think of many more decisions, many more questions people are asking these days. So we're here to talk about risk decisions mostly. So what is risk, and why does it matter? Well, because we live in a fallen and broken world, risk is just part of our experience. Risk, as we define it, is the potential for harm to someone's family, their team, their community, to themselves. This harm could be physical, it could be emotional, psychological, or spiritual. We can be desensitized to risk by repeated exposure to it. And for the purposes of my work with global workers, we use the following definition of risk threshold. It is the level of risk a family or a person is able to accept while maintaining healthy coping skills and continuing in service. There are many things that affect people's decision about risk, or their ability to accept certain levels of risk, many factors, and we'll talk about those in a minute. But either way, we don't want to criticize or judge others based on their risk decisions. Let's just assume the best of one another. We know that in Scripture, sometimes Jesus himself accepted great risk, and other times he avoided danger. The level of risk a person can accept is influenced by many factors, and it changes over a lifetime. It can change during different seasons of life. As I said before, no one should be critical of others regarding these decisions. They are difficult decisions to make. We should assume the best motives of others and try to understand the factors that influence the decisions people make. One factor might be the number or type of past traumas the person has experienced and how those were dealt with. It could be a season of life that a person is in where they have significant responsibilities, or there may be health, mental or physical conditions to take into account. It could be a personality. Some people who are just more personally or just more risk-taking personalities. their expectations of the place where they are and where they live. It may be the relationships that are impacted by their risk decisions. Some people are in a season of life where they have small children and they have to take those children into account. They may be an only child, they may be the only child that their elderly parents have to look after them and take care of them. There could be ministry impact that helps the decision be made. If in fact, staying in an area means that you're going to be isolated, and yet your ministry really requires you to be in a lot of social settings, then that may help you make the decision about whether you should take the risk of staying or not. There could be cultural or even theological factors involved in making that decision. But again, I just want to really impress on all of us that we don't want to judge people. We really don't want to turn this into simply a spiritual decision, because there are many factors that influence someone's decisions about risk and risk threshold. Should I stay or should I go? For those of you who work with people living abroad, this is one of the most pressing decisions that they need to make right now, whether to stay or go. And it is a very individual decision. So here's a few questions you can ask to help guide them. 1, what is their calling and what's necessary for them to fulfill that calling? Is accepting risk just part of what they do and it's necessary? And if that's true, what level of risk? Because risk changes. What are the positive and negative outcomes of accepting this risk? So, when you talk about risk, you often hear about rewards. And what are the rewards if you take the risk? And so this is a question they have to ask. Another one is, how does the current situation impact your ministry or your work and your ability to do that ministry? Is it limited? It might be halted altogether because of the social isolation that's having to occur right now. And then what is your rationale for staying? Really, it's helpful to have someone write it out or just talk it out. And this is where a good listening pastoral care person can be such a big help right now. Another question is, what is your access to adequate medical care if you stay where you are? Who in your immediate family might be medically impacted by this epidemic? And are essential supplies available where you are, where you live, and will they remain available for you and your family? Another question, what are your viable choices? Maybe it's to shelter in place where you are. Maybe another choice would be to relocate nearby or relocate to a larger city near medical care or where supplies are more available. And then finally, it may be that for someone working abroad, they need to relocate back to their home country. What are the current travel limitations? We have many countries now who are shutting down the borders. And so there's a time limitation on this. So it may be that people are running out of time or have run out of time altogether to actually get out of that country and into their home country. So if that's the case, how do we help people where they are to make the best decisions that they can about where they're at and where to stay and what's available to them? Another question, what are the recommendations from your team, your local partners, your sending organization, your home church, any reputable agencies like the WHO or CDC? And what about your extended family? What are they saying? And finally, let's talk about who is affected by your risk decisions. That's a great question to ask anyone who you're guiding through this discussion. So who's impacted and how? And I like this graphic a lot, this little circle graph, because in the center it shows the worker, the person that you're helping. It may be a couple, maybe an individual, And I just asked them to fill up the bubbles, fill the circles, think through who is impacted by my risk decisions. Well, first of all, if it's a family, if it's a married couple and they've got children, your immediate family, your children are impacted. Um, and what about your extended family? Do you have elderly parents at home that need you to come take care of them? Do you have people who rely on you for income or care? Your church. I mean, we are a body of believers. We care for one another, and people are impacted by the decisions we make. Your organization, um, local partners, friends in ministry that work with you and care about you, and they often know the culture, they know the situation so much better than you do. So how can we listen to them and hear from them? And how are they impacted by whether we stay or whether we go? Your team around you, and what are the decisions they're making and why? And then the person that you're working with, if you are the pastoral care person who's asking these questions, um, the person you're working with is going to be able to fill in these other circles themselves. So thinking it through. If we're guiding someone through a risk discussion, I would want to find out a few things. How do they make decisions about risk? As a single person, who do they involve? If they're a family, do they involve all the family members? Who and what ages are involved? If you're married, are both the spouses in agreement? Are you personally aware of the factors that are influencing you? So I would be asking and exploring that with someone. Did they understand the personal factors that we mentioned earlier and how those things could be influencing their decision? I'd be listening to hear about what they believe about risk. Do they understand that the scripture does illustrate that there are times to leave and there's times to withdraw? Um, what are some of the ways they might know it was time to leave? What would confirm to them that they should stay there? Another question, are there ways, if they stay, are there ways that they can decrease their risk? Where and what are those ways? So finally, I would be encouraging those I work with to encourage others. If they're married, encourage their spouse. Try to show sensitivity to others in this area of risk decision making and risk acceptance. So during a crisis, it's so important that people have a risk acceptance plan in place. We often hear about risk assessment, and risk assessment is important. We have to assess a risk in order to know what our threshold is regarding that risk. But it's also important to understand how much risk can I and my family accept at this time, and what happens to change that. And one way we do this is with a little system I call a green light, yellow light, red light risk threshold plan. Here's how it works. Have the person or the couple you're working with discuss and write down their plan for facing risk. So hopefully you've already worked with them through some of these other questions. At this point, they should be able to make an action plan for 3 levels of risk, including in that plan what the factors are that would indicate to them that a new level has been reached, and what steps would they take for each one of those levels. So a green light level. This is when their normal level of risk is at place in their area where they live. Now, for some people, even normal is a bit high, depending on where they live and what the natural or normal risks are in that place. So that's where they can assess all the known risk and determine what normal feels like. I would say at this point, really globally, I think all of us are outside the normal right now. So yellow level, the yellow light level is when risks are above average and it makes us feel nervous. Okay. And we need to know what are the factors in place when around us when that happens. So for instance, I start getting a little nervous when I go to the grocery store and they're all out of toilet paper, bread, certain meat products, milk, all these essentials, it makes me nervous. And I want to know, when are those things coming back? So I would say most of us globally are at a yellow light level right now. What about a red light level? That is when staying, or the risk is high and staying actually becomes dangerous. And we know this based on those predetermined factors. Are you thinking about supplies? Are you thinking about medical care, about who is impacted? Do you have a spouse or a child in your family that's at risk medically? Transportation shutting down, borders closing, those kind of things. That's when we get into a red light situation. So in this kind of plan, each individual or family would think through a plan like this and update it during this epidemic crisis as new information becomes available. How do we know that we've moved from green to yellow? And then how do we know when we've moved from yellow to red? And if we have, what steps do we need to take now? And as much as possible, getting spouses in agreement on that and moving forward and being sensitive, but talking about it and making the plan, put it on paper and help people think this through. So let's talk about a couple of definitions, okay? Terms. Right now in the news, we're hearing a lot of different terminology. We hear about isolations, lockdowns, shutdowns, but there's two terms with meanings that are globally recognized in the world of disaster response: quarantine and shelter in place. Now, these are not synonymous. They don't mean the same thing. And it's important to recognize the difference, okay? So, a person who, if you're quarantined, it means it's because you've been exposed to the disease. The person is being separated from others and is refraining from travel until it's clear whether they have caught the disease or not. And depending on your community or what the rules are for quarantine, you may have to pass a test a couple of times before you're all clear. And then even after you're all clear, it may be that you're sheltering in place. That means residents are staying home unless their job is considered an essential category like government or healthcare. Food is probably being delivered, or you're having takeout, or you're maybe going only outside for small amounts of time. I know in our area, you can go to the grocery store, you can go to drive-throughs, and you can go to the pharmacy. When you are outside, you're staying at least 6 feet away from others. Now, in other places, a shelter in place, they're not allowed to go out even outside their house. They stay inside. So it just really, those kind of directives are put in place in the community or the country. So if you are quarantined, it's because there's been an exposure either directly or indirectly to the virus. What are the challenges? So during a pandemic, there's many challenges besides the risk decisions that we were talking about. Some of them involve the affected community connections that are diminished. And this is very difficult, especially for those who are already socially isolated for whatever reason. And some of those people have in the past relied very heavily on social support networks, and those things are overloaded right now. And so this is a big problem. And we're hoping, of course, with our ability on the internet to reach out to each other, that people will take advantage of that. Also, during an epidemic, much like in other natural disasters, entire communities are affected together collectively, okay? But unfortunately, the places that used to offer support and safety for people, like the churches, the synagogues, and community centers, are not accessible during this time. The other thing that happens is those who have existing mental health conditions may experience some exacerbation of their symptoms. Others who've never experienced mental health issues before may suddenly start experiencing things like depression or anxiety, and they may need to seek help. And then there may not be good help available because the health system is overloaded right now. An economic decline, it can have a significant impact on everyone throughout the community and the nation, and at an individual level, as people just need to get basic supplies or pay for medical care. People staying at home may not necessarily be eating well or exercising well. Vulnerable children and adults, they may be exposed to really unhealthy home situations right now, and they are unable to access the social support that they maybe could have in the school systems or whatever prior. So, people with underlying medical conditions can be severely impacted by the virus. And also, as the healthcare systems are overloaded with virus patients, people with other medical conditions are either left untreated, discouraged from coming to the hospital because of the contagious uh, issue with the disease. Um, and finally, because of isolation rules, this means this virus is very, very contagious. And so there are mandates put in place in hospitals that really limit visitors and people that can be with you if you are sick. And so that means, unfortunately, that many people will suffer and die alone. And some people will not even go to the hospital. They have no one to take them to the hospital, or they'll try to stay at home um, and suffer without people around them to care for them. And these are just some sobering realities that we have to face during this challenge. But they're important things to be aware of, especially as you're offering pastoral care, whether it's talking to people and guiding them through the risk decisions or just guiding them through the anxiety and the fear that's so prevalent right now. If you are helping others through this crisis, there's just a few things that I would encourage you to remember. One, know your own risk threshold. Okay, don't take someone else through this if you haven't been through it yourself, if you haven't thought through it yourself. I don't know where you are in the world if you're in a place where you may have to relocate and think through those things. Be prayerful. There is power in prayer, and so don't forget to pray. Pray for the people you're working with. Pray for your own self. Pray for discernment and guidance. Be available to people as you're able to. Realistically, be available to people. Ask good questions, and I've given you a lot of good questions here to ask. And as you do, listen well. And I just encourage you, don't be the advice giver. Um, Come alongside people, guide them, help walk them through, but really listen to them and really empathize and listen to their concerns, and maybe even reflect back to them what you've heard them say so that they can hear what you heard. And don't judge their decisions, whatever decision they make about risk. Do understand the moral and ethical dilemmas that people face. And as much as possible, as you're working with these healthcare workers and you're ministering to them, I encourage you to really step into the dilemmas they face and try to understand the dissonance they feel as they make those critical decisions. Um, do foster resiliency in folks, and don't encourage dependency on you, um, but instead recognize their strengths and encourage those. And not only recognizing other people's strengths, but recognize yours right now too. Follow up on those people you work with. Don't just meet with them and then leave. Avail yourself of good resources and factual, accurate information. Don't be a person giving out bad information, and don't give medical advice unless you are a medical professional. Finally, please take care of yourself. Rest, reflect, and renew yourself in God's word and in prayer every day. Don't neglect yourself in this, because you can't care for others if you don't care for yourself. Thanks a lot thanks just so much. My prayer for all of us through this crisis is that we will remember the ever-present love and faithfulness of God. So be blessed. And thank you for watching this training video. If it's been helpful to you, please feel free to share it with others. Thanks.